Our next speaker is Dr. Subhash Wadodkar, and he will speak on prevention of the flu and role of herbal formulation Pratishayahar, Kashaya, on the background of H1N1 or a swine flu. Thank you.
Good afternoon. Respected chairperson, dignitaries on the dais, and friends. Friends, today we are facing numerous health problems. There are several unknown health enemies like SARS, Ebola, chikungunya, HIV, swine flu, and many more are waiting to attack on us. If we look into the Ayurvedic pharmacopoeias, it looks like a great ocean. There are around 30,000 herbal and herbomineral formulations mentioned in the various samhitas and rasagranthas. But we are using very typical and few numbers of formulations in our daily practice. It's time to, or we can say it's an opportunity to judge our drugs efficacy on our different formulations, which are already time trusted. Hence, prevention of flu and role of herbal formulation, Pratishayahar Kashaya, on the background of swine flu is an effort made by us to test the efficacy of the formulation. This is the scenario at the time of 2009 when swine flu struck Pune and all around districts. We have decided to distribute free of cost Pratishayahar Kashaya to these people to build up immunity against the flu and allied symptoms through our NGO, Dr. Wadodkar Medical Foundation, Rotary Club of Jalgaon Gold City, Mira Ayurvediya Panchakarma Chikitsalaya Jalgaon. Aims and objectives: to see the prevention of flu and role of herbal formulation Pratishayahar Kashaya on the background of swine flu is the main aim of this study. Materials and methods. Group 1, selection of the patient. In group 1, those patients who have signs and symptoms of flu but not diagnosed as a swine flu due to overload at diagnostic centers are selected. In group 2, those persons who don't have signs and symptoms of flu but are in contact with the patient suffering from flu are selected. And third group of people was kept in observation for the study, and that is those people who don't have signs and symptoms of flu but they are not ready to consume any medicine are considered as control group. These are the signs and symptoms mentioned. Exclusive criteria: patients with poor GC are excluded. Patients having other diseases like asthma, TB, acute respiratory diseases are excluded. Below 3 years and who have not completed the time or duration of the treatment are also excluded from the study. Symptoms: a person having symptoms like runny nose, coughing, fever, sore throat, vomitings are considered as Pratishayah patient. The disease Pratishayah is well defined in Brihatraya and Laghutraya in the name of Pinasa and Pratishayah. If we look into the causative factors or hetu, Pratishayah is exactly represents our today's lifestyle. I don't go in details of this. We use Pratishayahar Kashaya for Rugna Bala Vardhan, that is to improve Vyadik Shamatva or immunity. Pratishayahar Kashaya contains Trikatu, Vacha, Dalchini, Haridra, Vasa, Bhumi Amalki, Gokshur, Guduchi, Ashwagandha, Tulsi leaves and Adraka. All these ingredients in this formulation plays an important role to improve immunity. Individual ingredient possess the property like antihistaminic, anti-inflammatory, expectorant, analgesic, blood purifying and best immunomodulator in the nature. We use Lakshmi Vilas Ras as a Vyadhi Pratyanik Chikitsa. Lakshmi Vilas Ras is well-known drug used not only for Vajikarna but also Sannipata Jvara, Pratishaya, Kasa, Swasa, Pinasa and Galashotha, Galagraha, Shirashula and Kshaya. Dose and duration of the treatment. Every time fresh prepared Pratishayahar Kashaya 50 ml decoction for adult and 15 to 20 ml for pediatric youth. Advice to take 3 times a day for 15 days. Follow was kept for next 15 days. Lakshmi Vilas Ras 40 to 60 milligram 2 times a day for pediatric use and 125 milligram 3 times a day for adult use. Anupana is honey. Adverse effect or toxicity. During this therapy, there is no any adverse effect or toxicity observed. Follow-up study was carried out for next 15 days. In group 1, symptomatic relief in runny nose is 75.52%. In coughing, it is 80.44. In fever, it's up to 85.03. Sore throat reduces up to 92.79%. Vomiting reduces up to 94.92%. Total average percentage of relief of group 1 patient is 85.74%. On the other hand, if you observe group 2 and 3, it is clear that the group 2, where only Pratishayahar Kashaya was given to improve the Vedic Shamatva, symptomatic aggravation is very less as compared to group 3. The comparison of observations of all 3 groups after every 5 days clearly indicates that symptomatic relief in group 1 is very high. On the other hand, in group 3, symptomatic aggravation is very high and faster as compared to group 2. It is also clear from the study that flu or Pratishayahar can be confidently treated with the help of Ayurvedic medicine. In this study, Pratishayahar Kashaya for Rugna Bala Vardhan and Lakshmi Vilas Ras for Vyadhi Pratyanik Chikitsa are very much effective to treat the Pratishayahar on the background of swine flu. It is also clear from the study that Pratishayahar Kashaya is very much effective to build up immunity and prevent Pratishayahar in all respect. My sincere thanks to my father late Vaidharaj Siddheshwar Shastri Wadodkar, late Vaidharaj Srikar Jalukar, international legendary personality Dr. Subhash Ranade, Dr. Sunanda Ranade, and all the organizers of this conference and Meru. Thank you. Jai Gurudev.
Thank you. Thank you. Thank you very much. That was very interesting.